During week 5, you will learn about roadblocks to good communication, elements of a good interview with some video examples, and we'll also add nutrition intervention to your ADIME toolbox, along with how to write learning objectives for a patient nutrition education session. Let's look for a moment at nutrition intervention. There we go. Here you will determine if the intervention is related to food or nutrient delivery, such as needing to modify food choices, let's say for a lactose intolerant patient needing dairy alternatives. An obvious intervention is or could be nutrition education, where you create a short lesson to instruct or train a patient on specific food choices or food avoidances. It could be as simple as coordinating nutrition care with other healthcare team members, such as nursing, to facilitate a between meal feeding like a liquid supplement or snack to promote weight gain. This could also be facilitating a group presentation. All of these involve planning to first prioritize the nutrition diagnosis and then determine the outcomes that you anticipate. Then create a few learning objectives if you will be instructing or educating your patient. And finally, implement that instruction. Be sure to review the learning module on writing learning objectives, watch the short video, and review the content, especially the examples that I provide. This is a nice learning module. All right, this brings us to weekly assignments. How about here? All right, so 5A on communication. Let me pull up that assignment. All right, you'll see a number of questions here. This isn't long. These are very, very easy, but you do need to review the weekly folders, especially the folder on reflective listening. All right, and then 5B is all about patient interviewing. I'm sorry, is all about peer interviewing. An important reason for attending the Zoom session this week is that we're going to be involved in doing some peer interviews. Actually, you'll all be involved in that. I've given you a script for interview questions, which you'll practice with your peers as you take on the role of the NDTR. And then you'll also act as the patient. Take time to evaluate your peers' interviews, and then for assignment 5B, you'll complete the Tell Me sheet, uploading into Blackboard. So you'll notice that I've written basically a script here for you. You can add other questions as well when you interview your patient, meaning your fellow peer. And then on the Tell Me assignment, you'll see those questions at the top again that you can use as your script. And at the bottom are several things I'd just like you to do a little bit of self-reflection about your peer interactions. So this is really a very easy assignment. And then we have writing learning objectives for two patients you're already familiar with, Mrs. Sowry and Mr. Wood. And we're actually going to do those during the Zoom meeting. And so these should both be very easy for you to clean up and finish, to turn in for Saturday. In addition, there is a post-test, and there is also a checkpoint 3. So check the quiz tab for that. On just a reminder now about the Zoom meeting. This is on Thursday of this week. We meet at 6:30 to explore the topics I've just mentioned: nutrition intervention, practice interviewing with your peers, and writing learning objectives for 2 patients that will help you to complete those weekly assignments. Please prioritize attendance to check those weekly tasks off your list. If your work schedule is infringing on our meeting time, try to arrange to take your break during our session to catch at least a portion of the meeting. Have a great week.